Let's talk about coronary angioplasty. Coronary angioplasty is a medical procedure in which a balloon is used to open a blockage in a coronary artery narrowed by atherosclerosis. This procedure improves blood flow to the heart. Angioplasty is a common medical procedure. It may be used to improve symptoms of CAD like angina and shortness of breath, reduce damage to the heart muscle from a heart attack, reduce the risk of death in some patients. When medicines and lifestyle changes such as following a healthy diet, quitting smoking and getting more physical activity don't improve your CAD symptoms, you'll be advised other treatment options. These options include angioplasty and bypass surgery, which is a type of open heart surgery. Compared with bypass surgery, some advantages of angioplasty are that it has fewer risks than CABG, no general anesthesia is required, has a shorter recovery time. Coronary angioplasty is performed in a cardiac catheterization laboratory. The cath lab has special video screens and X-ray machines. A small cut is made in your arm or groin into which a tube called a sheath is introduced. Then a long, thin, flexible tube called a catheter is passed through the sheath and over the guide wire into the coronary artery. A small amount of dye may be injected through the catheter into the bloodstream to help show the blockage on the X-ray screen. Next, a small deflated balloon is passed through the catheter and into the coronary artery where the blockage is there. When the balloon reaches the blockage, the balloon is inflated. The balloon pushes the plaque against the wall of the artery and widens it. This helps to increase the flow of blood to the heart. The balloon is then deflated and removed. Then a stent, which is crimped onto a balloon, is deployed again using the same technique. On inflating the balloon, the stent expands against the wall of the artery. The balloon is then deflated and pulled out of the artery with a tube. The stent stays in the artery. Most people go home in 1 to 2 days after the procedure. You'll be advised medicines to prevent blood clots from forming. Taking your medicines is very important. If the stent is inserted, the medicine reduces the risk that blood clots will form in the stent. Most people recover from angioplasty and return to work about 1 week after being sent home. Although angioplasty is normally safe, there is a small risk of serious complications such as bleeding from the blood vessel where the catheter was placed, damage to the kidneys caused by the dye used. Heart attack can occur very rarely in 1 to 2% of people necessitating bypass surgery. Rarely, brain stroke can occur in less than 1% of patients. There is a chance that the artery will become narrowed or blocked again in time, often within 6 months of angioplasty. This is called restenosis. This is because of the growth of a scar tissue in and around the stent. Medical coated stents or drug coated stents reduce the growth of scar tissue around the stent and lower the